Hello, this is a pleasure to be here today, and thank you for joining us in this interview. I am Juliette Raffort-Lareyre. I'm consultant in medical biology at the University Hospital of Nice and shareholder in artificial intelligence at the Institut Côte d'Azur. I am member of the social media team for the PVI, and today we are very honored to have with us Professor Timothy Resch, who is a renowned professor at the Department of Vascular Surgery in Copenhagen Aortic Center. Professor Resch, you are also part of the organizing committee of the PVI that will take place in Paris in December. So please feel free to introduce yourself as well.
Yes, well, great to be here. I'm, as you said, Tim Resch. I'm from Copenhagen. My main field of interest is aortic repair and endovascular aortic repair. That's what I do most. And I had the complex aortic team in Copenhagen as well. And I'm also the editor for the book chapter on aortic disease in the PVI trials book, which is being released in its third edition this year. So all very exciting.
Thank you for this introduction. Professor Resch, so as an expert author of the PVI trials book, you covered clinical trials related to aortic disease. And for people who haven't read it yet, I really recommend this book as you can easily download it on the PVI website. And I have to say that I really like the format because it's very simple. One trial is summarized in one page, and I think it really gives a straightforward message, so thank you for that. So you summarize and cover the many clinical trials, and I know there's a lot to cover, but can you please give us a short overview of your chapter's topic, please?
Yeah, so what we've tried to do in all the chapters and in this topic, of course, is to include not only randomized trials. We wish there were more randomized trials in this specialty, but we're trying also to promote good clinical trials that are done that will give vascular surgeons guidance in their day-to-day practice. So that's the way we select. The book is updated every year. So we update with the latest year, and it goes 5 years back in time. And really, in the aortic chapter, you can see the development is moving a lot towards more and more trials in endovascular repair. And specifically for this year, we can see the increased interest and the increased data availability for complex aortic repair. So which is becoming more and more standard. So it's interesting to find that, and that we're getting more and more good data to evaluate complex aortic repair as these numbers increase and the technology spreads worldwide. So really, the book chapter covers everything from simple aortic disease, infrarenal and thoracic disease, to complex disease and arch repair. It's around, I think this year we have 21 different studies included. If the readers are interested, obviously they can look back at the old editions and see the old trials, but to just make it manageable, it's an update. And really, this year it's a lot of focus. The new trials are mainly on complex repair that I've picked for the book, not only because they're on complex repair, because actually that's where most of the new data is coming out.
Okay, thank you. So a lot to read and a lot to learn. And among the different trials that you presented, is there a few that you think we really should keep in mind? As an example, are there some of them that could directly impact or reshape current clinical guidelines?
Yeah, so a really important trial is the acronym STAGED-FEVAR trial, which was written by Fernandez and coworkers, and it was published in 2025. This is a meta-analysis systematic review of almost 2,000 patients who have undergone elective FEVAR for extensive thoracoabdominal repairs, and looking at the standard endpoints of mortality and spinal cord ischemia, acute kidney injury. And the conclusion is very firm, says that if you stage the repair, if you do them separately and separate them, this is a significant benefit for the patient, reduces the risk compared to a single stage repair and these extensive repair. And obviously, You have to be careful so that the aneurysm is not high risk and that the patient can tolerate this. But in standard clinical practice, the staging of repairs can really reduce complication and improve the outcome. So I think that's a very important trial for people to read up on, something you can implement immediately into clinical practice.
Okay, thank you. So this is the third edition of the trial book. Could you highlight what's new in this book from the last edition? What are the main new insights?
Yeah. So again, this is this year the main update focus has been on complex repair because this new trial data is coming up. There's some interesting data on the Gore-Tambi device, the first thoracoabdominal device approved in the United States, which confirms in this very controlled trial setting what we knew, that branches are a bit, don't perform as well as fenestrations for renals. So you have to be careful there. And as well, there is a study in the update which looks at to compare open repair and endovascular repair for complex disorders, which was published by Italian group late 2024, which also shows that patients do very well with endovascular repair compared to open repair, comparable mortality, but much lower complication rates. So really, I think that these 5 new studies that are included in the trial highlight that complex endovascular repair or endovascular repair for complex disease has become the primary option to treat this very complex disease in suitable patients.
Okay, thank you very much. And also, we're talking more and more about sex differences on the outcomes of patients with vascular disease. Are there any trials or studies that talk about it in the book?
Yeah, so we have a study that was actually included already last year, which we've called the SEXAAA trial, which is a very large retrospective registry trial from the UK, including almost 20,000 patients, where they looked at outcomes after regular infrarenal EVAR over a large time period to try to figure out why the outcomes in general are not as good in women as they are in men. And I think that the main finding in the trial was, despite they corrected for what they call standard of care for these patients, that they were treated according to protocol, despite that, despite adhering to IFUs and so on, the outcomes were still worse in women. And I think we're all a little bit still perplexed by this. So there are a lot of studies ongoing to look closer at outcomes for EVAR and also open repair in female patients. And hopefully we can include those trials in the book in the future when they come out.
Definitely. And one last question, maybe. We all heard about the UK Compass trial. Could you maybe give a few words on it? And because it was on the last edition, are there going to have a new updates on it in the new edition of the book?
So I think this is a very important trial. It's been debated heavily. It came out last year, and it's been debated heavily on during all the meetings and also during PVI last year when Professor Mastracci from London debated on this trial. It's a very large set of patients from the UK where they looked at the outcomes, trying to do a propensity score analysis to compare endovascular and open repair. And you can look at this and dice it and slice it in many different ways, but I think that the outcome here is that patients that are very poor risk for repair and are not suitable for infrarenal standard EVAR should not have infrarenal standard EVAR because they will do very poorly. But in most patients that have juxtarenal aneurysms with short necks, FEVAR is clearly better with regards to mortality, both at 30 days and midterm. But it also shows that there still is a place for open surgical repair, where if they have a longer neck, but standard risk, and they're young and quite fit patients, open surgical repair is definitely a good option for these patients. So I think it possibly raised more questions that it answered, as is often the case in these types of trials, but it also gave us a lot of new information and food for thought.
Definitely. So it gives valuable information and level of evidence, but we still need to perform more research to know how it's going to reshape clinical guidelines, right?
It's always like this, even if you do what you think is a perfect trial at the outset, and to try to answer one question, and during the trial, you often come up with 10 or 20 new questions. So this is the way science works.
Yes, this is a principle of science and research.
Yes.
Definitely.
And it's also because the whole arena of aortic repair, endovascular repair is a moving target. So good trials and solid trials take a long time to execute and perform. And during that time period, of course, technical developments occur. We learn more from all the concurrent trials, and then new question arises. So yeah, that's what makes it interesting. But in the end, I think we slowly but surely move towards better care for our patients.
Yes. Is there anything else that you want to highlight regarding the trials?
Actually, no, I think you should sit down and read the book. It's very, very good. For me, as an aortic surgeon, I actually read the other chapters, not the aortic chapter that I've edited myself, but the trials book is fantastic to get a rapid overview of your fields of maybe not so high interest, but you learn really a lot, and all edited by expert authors. So really good information, I think.
Yes, definitely. And the format is very, very efficient, I think, because
It is.
you have all the main information just in one page and it gives you the message.
And I think, yes, it gives you the message. And also, as opposed to reading the abstract in the journal that you first have to find yourself, this has been curated by an expert editor who has picked out not only the best studies, but also helps the reader to interpret what the study actually says and what it means and what's good and not so good. So it's 5 minutes with the professors. So I think it's excellent.
with a critical analysis.
Yes,
That
exactly.
helps to understand the results.
For sure.
Okay, thank you very much for this insightful discussion. Thank you for watching us. We are looking forward to welcome you in the next PVI in Paris in December to share experience and knowledge with renowned experts in the field. So save the date, 11th to 13th of December, and see you soon.
See you all in Paris.